more than 50% of cancer patients would benefit from radiotherapy at some point in their cancer journey. Radiotherapy sometimes is used on its own in order to avoid surgery and spare the organ. Classic example is radiotherapy for larynx cancer or prostate cancer. At other times, radiotherapy is used in combination with surgery or chemotherapy or both to maximise the chance of cure and minimise the risk of toxicity.
It's also very effective when used to help symptoms of cancer, particularly in advanced cancers where the cancer might have spread to the bone or other parts of the body and causes pain. That might be a possibility down the track if the painkillers aren't working.
In 2004, I was diagnosed with breast cancer. And in 2012, I fell in a bathtub in Germany and I came back to Australia. The doctor requested that I should have an MRI done. And from there, we can see all the metastasis, which is the bone cancer, on the left shoulder, on the ribs, on the spine, on the right hip, and the right skull. Then I went for 5 sessions of radiotherapy. The results of the radiotherapy for the bone is good.
Keely is a community ambassador for the Cancer Council. Would you please make her welcome? So, again, what's your experience with cancer? What was your experience?
Almost 4 years ago, I was diagnosed with stage 4 breast cancer, which means that my breast cancer has spread from outside the breast into 75% of my liver, my bones, including my spine, my femur, my collarbone, which my daughter broke by headbutting it, and also my brain. So when I was first diagnosed, I was told in the emergency department at RPA that I had 2 weeks or maybe 2 months to live, and thankfully they were wrong.
How long ago?
It'll be 4 years next month.
She's alive. The treatment, in a nutshell, what have you had to endure?
I've had a number of chemotherapies every week for the first 2 years, and now I still go every 3 weeks for Septin, which is a targeted therapy, which is why I have hair now and things. I've had radiation on my hip, I've had radiation on my brain, I've had brain surgery, I've had...
Can you explain the significance of stage 4?
There's no cure for stage 4. The focus is on treatment, and I think I'm evidence that all the research that's gone into breast cancer is proving that we can have not only a longer life but also great quality of life. And I certainly thank everybody who's fundraising and things like that, because I'm the beneficiary.
We went through the first course of radiotherapy and it all went pretty well. Lucas went to sleep, he had to be anaesthetised, the word, every time, just due to his age and just because he was small, he needed to keep still. We got home after the first treatment, not know what to expect, and he vomited the first day, and we thought this is 6 weeks, so we're going to be doing this every day. He went to sleep after that, woke up fine, and that's the only time he ever vomited. Every other time we got home, he had a quick sleep and on the way home, and he was fine, eating lunch and playing by the time we got home.
When a patient is diagnosed with cancer and is sent to a radiation oncologist who's the specialist doctor in this area to talk about possible radiation treatment, the doctor will take all the information they have about the patient, the cancer and the tests, and talk to the patient about the options and what might be right for them. If a decision is made to give radiation therapy as part of the treatment, the next phase will be a planning phase.
What we do now is almost unrecognisable compared to what was done, 20 years ago. And this has led to better patient outcomes. The advances include improved imaging, such as high-quality CT scans, MRIs and PET scans, and these have allowed us to actually see the cancer. And when we see the cancer, we can more accurately define the target that we want to hit with the radiotherapy. And it also allows us to more accurately see the organs that we want to miss with the radiotherapy. We also now have much more sophisticated computer planning systems and radiotherapy treatment machines. And the treatment machines themselves, they're now equipped with multiple tools, for example, CT scans embedded in the machine themselves, to allow us every day before radiotherapy to look inside the patient, locate the tumour and position the patient accurately so that the radiotherapy each day is hitting that target.
The main machine we use to give the treatment is called a linear accelerator, and that generates very powerful X-rays that we aim very accurately at the patient's tumour as the machine moves around the body.
Radiation therapists are responsible for the planning and the delivery of the radiation for treatment. So for the planning side of things, that involves the patient coming in to CT and us setting them up for their treatment. So that could involve organising or setting immobilisation devices, such as whether it's a mask if they're having head and neck treatment, or a bean bag, what we call a vac bag, if they're having any breast treatment.
The main thing that I think of with radiotherapy for a head and neck cancer, which is what I had, is this extraordinary mask that you have to wear, an immobilisation mask, that is absolutely essential because it holds you precisely still so that the radiation beams hit exactly where the cancer is and don't hit the other good parts of your head. And I found that an immensely challenging experience. But the great thing about radiation for me was that it enabled me to get back the capacity to speak and to swallow and to taste and to have saliva, all of which I lost during treatment, but I got them back and I can work normally. Whereas my understanding is that if I'd had to have surgery, they would have had to have gone in through the side of my neck, and I may well have lost, I may well have lost speech, among other things.